everyone, welcome back to the channel. In today's video, I do a series of questions on deep vein thrombosis. So in my last video, I explained what DVT is. And so in this video, we want to trial some exam-like questions so that it helps us to test our understanding on the subject. Okay, so let's go right into it. We'll be looking at our very first question today. And your first question reads, the nurse is assessing a patient who has many risk factors for the development of a DVT. For signs and symptoms of a DVT, what signs and symptoms below would possibly indicate a deep vein thrombosis is present? Now it says that select all that apply. So in this type of question, you have multiple answers and you can have multiple correct answers. So you want to select all that apply. And the first one is cold extremities. B is decreased pulses. C is redness. D is pain. E, warm extremities. F, swelling. And G, cyanosis. So you want to take a few seconds, go through the options and write down your answers. Which ones are you going for that are possible signs of a DVT? So the answers for these questions will be option number C, which is redness, D, which is pain, E, warm extremities, and F, swelling. Now, what we need to understand is that for you to spot a DVT, you need to have swelling, which is usually unilateral. You need to have redness, erythema. You also need to have pain in that limb, usually the lower limbs. There's something we call the positive Holman's sign. Now, what this is that when you dorsiflex your calf, you find out that you have pain. So you dorsiflex your foot, and if you feel pain in your calf, it could be a sign of DVT, but this is not a very reliable symptom to look at. Question number 2. A client with suspected DVT asked the nurse if they should get up and walk to relieve the pain. What should the nurse do? A, encourage the client to ambulate. B, instruct the client to remain on bed rest until evaluated. C, apply warm compress and encourage mobility. D, advise the client to massage the leg gently. Take a few minutes and drop your answer in the comment section. So the correct answer for this question would be to instruct the client to remain on bed rest until this is evaluated. Now, the reason for this is that if the client actually has a DVT, ambulating is likely going to cause a dislodgement in the clot, which can travel into the lungs and cause a pulmonary embolism. So you want to first evaluate and make sure that the client doesn't have a DVT, and then you can go on to ambulate. Question number 3. Based on the Werkhouse triad, select which patients below are at risk of developing deep vein thrombosis. And we want to select all that apply. A 55-year-old male with hyperlipidemia and diabetes. B, a 70-year-old female with severe sepsis. C, a 25-year-old male who uses intravenous drugs. D, a 65-year-old female who is post-op day 1 after joint replacement surgery. Take a few seconds and then drop your answer in the comments. Which of these patient group do you think are more likely to develop a deep vein thrombosis according to the Werkhouse triad? So the correct answers for this question will be B, C, and D. Now, the Werkhouse triad tells us that there are 3 things that, when present, increases a patient's risk of developing a DVT. The first one is venous stasis. The second one is injury to the epithelium. And then the third one is a state of hypercoagulability. Now, a patient who experiences sepsis is at a risk for hypercoagulability of the blood. Patients who use IV drug damage the endothelial lining of the veins, and this can lead to clot formation. Also, a patient who have had joint replacement surgery is at risk of blood clots due to the stasis in the vein of circulation. So you want to look at what is in the Wilcox triad and then compare it to what the patient is presenting, and that is what gives you the correct answers to this question. The next set of questions is question number 4. It says that a patient is receiving continuous IV heparin for anticoagulation therapy for the treatment of a DVT. In order for this medication to have a therapeutic effect on the patient, your APTT should be, and it says A, 0.5 to 2.5 times the normal range. B says 2 to 3 times the normal range. C is 1.5 to 2.5 times the normal range. And D is 1 to 3.5 times the normal range. What do you think your answer would be? Drop it in the comment section. Let us now look at what the correct answer is. So the correct answer will be 1.5 to 2.5 times the normal range. Now, when a patient is on heparin, you need to measure your APTTs. So you've got the normal, and then what is expected if is a treatment dose for a DVT. Let's look at these. So this is just to tell us a bit more about our APTT. So heparin, which is usually given IV but can also be given subcut, is usually monitored with your activated partial thromboplastin time, which is shortened as your APTT. Now, your normal APTT usually is between 25 to 35 seconds, and then a therapeutic APTT, so we have DVTs and P are looking for something that is 1.5 to 2.5 times the normal, so that's about 46 to 70 seconds. Now, the antidote, the reason why I'm talking about antidote is that because it's an IV infusion, you can have it in a bit of an excess. That is why you monitor the APTT levels. If you have APTT levels very high, it increases your bleeding risk. And so your antidote will be protamine sulfate. So it's always wise to have some protamine sulfate in your bed space if your patient is on IV heparin. Now, the key lesson or the key Nclex tip you want to take away from this is that if the APTT is too high, you have an increased bleeding risk. So you hold the dose and then notify your healthcare provider, and then you may give the antidote if it's very high. The next medication we want to talk about will be warfarin. This is usually given as an oral medication. So for warfarin, you also need to measure your prothrombin time or your international normalized ratio. So you're looking at your PT or your INRs. Now, normal INR is usually between 0.8 to 1.2. However, therapeutic doses can range between 2 to 3. And in some cases, you may have it a bit higher depending on what is being treated. So we have mechanical valve patients who are on warfarin. They may need a higher INRs. Now, just like we mentioned for the heparin, there's an antidote for a high INR, usually that is vitamin K. So what is my key Nclex or nursing point to take away? If INR is too high, that is greater than 4.0, you are at risk of bleeding. So you hold those, you notify your healthcare provider, and then you prepare vitamin K. In your patients who are not on treatment dose for warfarin, if you have INRs above 1.3, usually you'll be considering giving vitamin K at this point. On to the next question. Question 5. A patient is prescribed warfarin for the treatment of a blood clot. What is the therapeutic INR range for this medication? I expect you to get this right. And now that we just dealt with the warfarin medication. So A, 2.2 to 3, B, 1 to 3, C, 4 to 8, and D, 0.5 to 2.5. Drop your answer in the comments. The answer is A. We said that therapeutic INRs usually range between 2 to 3 if you are treating the DVT. It may be slightly higher in some patients. So your mechanical heart valves may have a higher INRs, but a high INR basically tells us that the patient is at risk of bleeding. So question 6 says that your patient has a deep vein thrombosis in the left lower extremity. The patient is prescribed continuous IV heparin. Select all the nursing interventions that are appropriate for this patient. So here we have series of nursing interventions and we need to decide which one is appropriate for the patient. And the very first one is to apply cool compress to the affected extremity. Do you think this is something we should be doing? B, measure the leg circumference. C is to massage the affected extremity. D is to elevate the affected extremity above heart level. E is to encourage frequent ambulation. F is to monitor INR levels. G is to monitor your APTT levels. And then H, apply a sequential compression device on the affected extremities. Which of these nursing activities or nursing interventions do you think we should apply for a patient who is on IV heparin? So let's go through what the correct answers are. So you have B, which is you measuring the leg circumference, and D, elevating the affected extremity above the heart level, and G, to monitor your APTT levels. Now, why are the other ones wrong? Now, in a DVT, what you want is to rather put a warm compress because this is what is going to help with pain and circulation. Also, you don't want to be massaging or rubbing the affected side because when you do that, you increase the risk of a clot dislodging and moving into the respiratory system. Now, the patient needs to be on bed rest. Ambulation could dislodge the clot. INRs are used for warfarin and not heparin. So that's what you need to be very particular about, careful about, so it doesn't confuse you. Now your sequential compression stockings, you don't need those ones because when you apply them on affected limb, you increases your risk of developing a pulmonary embolism because clots may dislodge. Final question for this series. A client with a history of recurrent DVT asks how to prevent future clots. Which statement shows correct understanding? A, I should stay in one position for long periods to rest my legs. I will elevate my legs when sitting to promote venous return. I will avoid drinking fluids before long trips to prevent swelling. I should stop taking anticoagulants when my legs feel better. Drop your answer in the comment sections. Now, if you found this helpful, do also like the video, share it to a nursing colleague, a nursing student, and subscribe to the channel for more videos like this.